A presentation of the University of Alabama in Birmingham Dental Television. Dental Anatomy. Mandibular First and Second Premolar. A telecourse by Dr. Barry Eisenberg, Dr. Wilson Wright Jr., and Dr. Michael Hughes. Mandibular First Premolar. General characteristics. The mandibular first premolars are the fourth teeth from the midline and are identified according to the universal numbering system as teeth number 21 and number 28. They replace the deciduous mandibular first molar in the eruption process. The mandibular first premolar contacts the mandibular canine mesially and the mandibular second premolar distally. Only in relative size and appearance from the buccal aspect does this tooth resemble the adjacent second premolar. The mandibular first premolar has a closer resemblance in form and function to the canine than the other premolar in the mandibular arch. The first evidence of calcification of these teeth is between 1 3/4 and 2 years. The enamel layer is completed between the 5th and 6th year, with eruption usually occurring between years 10 and 12. Root formation is completed between the 12th and 13th year. The mandibular first premolar is always the smaller of the two mandibular premolars, whereas the opposite is generally true of the maxillary premolars. The buccal aspect. The outline viewed from the buccal aspect is basically pentagonal in shape, a similarity noted in both the canine and second premolar. Mesial outline. The cervical 1/2 of the mesial outline to the height of contour is straight to slightly concave. In the occlusal half, the mesial outline is convex. The height of contour is in the middle third. Occlusal outline. The mesial slope of the buccal cusp is normally shorter, leaving the cusp tip slightly offset toward the mesial. The mesial slope is normally straight, while the slightly longer distal slope often reveals a slight concavity. Distal outline. The outline of the distal, as viewed from the buccal aspect, is similar to the mesial outline, only shorter due to a slightly lower contact area and marginal ridge. Cervical outline. The cervical outline is an even, slightly convex curve toward the apex, being slightly less than that of the mandibular canine or incisors. Buccal surface. The buccal surface is convex both occlusogingivally and mesiodistally. It presents a buccal ridge representing the most prominent portion of the buccal surface and is representative of the greater development of the middle buccal lobe. This is consistent with the greater development of the middle labial lobe seen on the canines, known as the labial ridge. Mesiobuccal and distobuccal developmental depressions are usually present. The height of contour on the buccal surface is found in the cervical third. Root outline. The root is normally single, fairly straight, and its outline tapers from the cervical line to a relatively sharp apex. The root length is less than that of the mandibular canine. The mesial aspect. From the mesial, the mandibular first premolar is roughly rhomboidal in form, which is characteristic of all mandibular posterior teeth when viewed from the proximal. Buccal outline. The buccal outline is generally convex, with the height of contour in the cervical third, and then inclining toward the lingual in the occlusal 2/3. Occlusal outline. The occlusal outline reveals a transverse ridge sloping at approximately a 45-degree angle from the buccal cusp tip to the lingual cusp tip. The outline of the mesial marginal ridge nearly parallels that of the transverse ridge, only at a more cervical level. Since the crown profile from this aspect is inclined toward the lingual, the occlusal outline reveals the buccal cusp tip in a position very near the center of the vertical long axis of the tooth. The lingual cusp is very small and non-functional. Lingual outline. The lingual outline is slightly convex, with a height of contour in the middle third. Cervical outline. The cervical outline is curved slightly toward the occlusal, with minor irregularities. Contact area. The contact area is located close to the occlusal outline and toward the buccal in the middle third. It is circular to ovoid in shape. Mesial surface. The surface of the crown mesially is smooth except for the mesiolingual groove, which is one of the prime identifying features of this tooth. The surface is plainly convex at the mesial contact area, which is centered on a line with the tip of the buccal cusp. Immediately below the convexity of the contact area, the surface is sharply concave. Root outline. From the mesial aspect, the root outline is tapered from the cervical portion, ending in a relatively pointed apex, in line with the tip of the buccal cusp. The lingual outline may be straight, and the buccal outline is usually more curved. The root is wider buccolingually than mesiodistally. The mesial surface is smooth, flat, or slightly concave, with an occasional vertical developmental groove. The lingual aspect. The crown tapers toward the lingual, thereby making it narrower mesiodistally at the lingual than the buccal. The lingual portion of the crown is convex in all directions. Most of the buccal half of the occlusal table is visible from this aspect because of the diminished size of the lingual cusp and the slope of the occlusal surface toward the lingual. Mesial outline. This outline is similar to the buccal surface, only much shorter due to the shorter lingual surface. Occlusal outline. The actual occlusal outline is that of the buccal cusp because of its much greater prominence. Distal outline. This outline is similar to the buccal surface, only much shorter, again due to the shorter lingual surface. Cervical outline. The cervical line is slightly convex toward the apex. Lingual surface. The lingual surface is uniformly convex. The lingual cusp tip is short, but may be sharp, and of its mesial and distal slopes, the distal is slightly longer, offsetting the cusp tip to the mesial. A characteristic of the lingual surface of the mandibular first premolar is the mesiolingual developmental groove. This groove originates on the occlusal surface and crosses onto the lingual surface, near the mesiolingual line angle. The groove normally fades out at about the junction of the cervical and middle thirds. Root outline. The root of this tooth tapers evenly from the cervical to a pointed apex. The distal aspect. This view is very similar to the mesial aspect. The distal marginal ridge is higher above the cervical and does not have the extreme lingual slope of the mesial marginal ridge. No developmental groove is present on the distal marginal ridge. The major portion of the distal surface of the crown is smooth, convex, and is wider buccolingually than the mesial surface. The distal contact area is broader than the mesial, although it is centered in the same relation to the crown outlines. The location of the contact area is similar to the mesial surface, only at a slightly more cervical level in the middle third. The cervical line curvature is slightly less than that observed on the mesial aspect. Root outline. The outline of the root is similar to that observed from the mesial aspect. The surface of the root distally exhibits more convexity than was found on the mesial surface. A shallow developmental depression is centered on the root, but rarely does it contain a deep developmental groove. The occlusal aspect. The crown profile is more or less rhomboidal or diamond-shaped, with a notch in the outline mesially at the position of the mesiolingual developmental groove. A buccolingual plane through the tip of the buccal and lingual cusps, following the transverse ridge, divides the tooth into a mesial and distal portion, the larger of which is found on the distal. Because of the lingual inclination of the crown, much of the buccal surface, but very little of the lingual surface, may be seen from the occlusal aspect. Buccal outline. The outline of the buccal ridge is the most prominent feature of this surface. The buccal outline is rather uniformly convex, with prominent, though rounded, mesiobuccal and distobuccal line angles. Lingual outline. This outline is also convex, but much shorter than the buccal. Mesial outline. The mesial outline is slightly convex to nearly straight from the mesiobuccal line angle to the lingual cusp area. Distal outline. This outline is more rounded and convex than found on the mesial. Occlusal surface. There are two cusps on the occlusal surface, a buccal cusp and a lingual cusp, with the buccal cusp being much larger. Buccal cusp. The incline of the occlusal surface to the lingual results in the buccal cusp tip being located approximately over the long axis of the tooth. This cusp has 4 cusp ridges and 4 inclined planes, which are named according to their location. Lingual cusp. The lingual cusp is very small and usually no more than half the height of the buccal cusp. Transverse ridge. The central groove, which normally separates the 2 component triangular ridges in premolars, is often so indistinct in the mandibular first premolar that the triangular ridges, the buccal triangular ridge and the lingual triangular ridge, appear to be continuous, thus forming a transverse ridge. Marginal ridges. The mesial marginal ridge more closely resembles the marginal ridges of anterior teeth, especially the canine. The distal marginal ridge is longer, more prominent, and is more horizontal than the mesial marginal ridge. Fossae. Two irregular depressions on the occlusal surface are present, the mesial and distal fossae. They correspond to the mesial and distal triangular fossae of other posterior teeth. The mesial fossa is more of linear shape, while the distal fossa is larger and more circular in shape. Pits and grooves. The mesial and distal pits are located in the deepest portion of the two fossae. From the mesial pit, in the mesial fossa, the mesial developmental groove extends buccolingually. This groove is confluent with the extension, which becomes the mesiolingual developmental groove as it passes over to the mesiolingual surface. The distal fossa may contain a distal developmental groove, which is crescent-shaped. The distal fossa may also have accessory supplemental grooves radiating from it. Mandibular second premolar. General characteristics. The mandibular second premolars are the fifth teeth from the midline contacting the mandibular first premolar mesially and the mandibular first molar distally. They are identified according to the universal numbering system as teeth number 20 and number 29 and replace the deciduous mandibular second molar in the eruption process. The mandibular second premolar has a generally larger crown and slightly larger and longer root than the first premolar. The first evidence of calcification of these teeth is between 2 1/4 and 2 1/2 years. The enamel layer is completed between the 6th and 7th year, with eruption usually occurring between years 11 and 12. Root formation is completed between the 13th and 14th year. The mandibular premolars are noted as transitional teeth, with the first premolar reflecting the transition from the canine. The second premolar shows a definite transition toward the molar. Because the mandibular first and second premolars bear a resemblance to each other, only pertinent similarities and differences between the two will be given. The buccal aspect. From this aspect, the mandibular second premolar very closely resembles the mandibular first premolar. It presents a shorter buccal cusp than the first premolar, with a mesial buccal and distal buccal cusp ridges having less angulation. The contact area appears to be at a higher level due to the shorter buccal cusp. The root from this aspect is broader mesiodistally than that of the first premolar, and the root outline ends in an apex which is more blunt. The mesial aspect. From this aspect, the lingual cusp are much more prominent than in the first premolar. The surface is convex in the occlusal portion and concave toward the cervical portion. The buccal cusp tip is not centered over the root axis, as in the first premolar, but is located slightly buccal of center. The marginal ridge is horizontal, and less of the occlusal surface can be seen from this view. There is not a mesial lingual developmental groove from the mesial aspect of the mandibular second premolar, as was seen on the first premolar. The contact area is located close to the occlusal toward the buccal surface at the junction of the occlusal and middle thirds. The cervical line shows less occlusal curvature than seen on the first premolar. The lingual aspect. From this view, it is noted that the lingual cusp or cusps are well developed in comparison to that of the first premolar. The mesial, distal, and cervical outlines are similar to those of the first premolar, although the lingual surface is wider mesiodistally and longer occlusocervically. Occlusal outline. The occlusal outline is higher than the first premolar, and as a consequence, much less of the occlusal surface can be seen. The cusp height of the lingual cusps is somewhat shorter than the buccal cusp height. Most often present on the second premolar is a three cusps type, and when viewed from the lingual, two lingual cusps are more often seen: a mesial lingual and distal lingual cusp, separated by a lingual groove which extends a short distance on the lingual surface. The two cusp type presents a single lingual cusp on the lingual surface. No lingual groove is present, but a developmental depression is normally found on the distal lingual. The single lingual cusp is approximately the same height as the two lingual cusp type. The lingual surface is generally smooth and convex. The distal aspect. From the distal aspect, the distal marginal ridge is more cervically placed than the mesial, resulting in more of the occlusal surface being visible. In the three cusp type, the tip of both the mesial lingual and the distal lingual cusps are visible. The contact area is similarly located as the mesial, but because of its contact with the first molar is larger and somewhat ovoid. The occlusal aspect. The general shape of the crown from this aspect is more nearly square, especially in three cusp type when compared to the first premolar. There is not a great convergence of the outline toward the lingual. Most common is the three cusp type, also known as the Y type, which presents definitive occlusal characteristics. Cusps. The buccal cusp, the largest of the three cusps on the occlusal surface, is followed in size by the mesial lingual and then the distal lingual cusp. The cusp ridges and inclined planes of each are 4 in number and similar to the other posterior teeth. There is no transverse ridge on the Y-type second premolar. The occlusal groove pattern is responsible for the naming of the types of second premolar. In addition to the Y-type groove pattern, some mandibular second premolars take the form of a U shape. These have two cusps. Fossae. There are two fossae, the mesial and distal triangular fossae. Both are relatively shallow and roughly linear in form and located just inside the marginal ridges. Pits and grooves. On the Y, or three cusps type, there are 3 pits present: the mesial, distal, and central pits. The mesial pit is located just inside the mesial marginal ridge in the depth of the mesial triangular fossa. It is the point of union of 4 primary grooves: the central groove, the mesiolingual triangular groove, mesiobuccal triangular groove, and the mesial marginal groove. The distal pit is located in the depth of the distal triangular fossa and is also the point for 4 primary grooves: the central groove, the distal lingual triangular groove, the distobuccal triangular groove, and the distal marginal groove. The central pit is the deepest of the 3 pits and located toward the lingual at the junction of the central groove with the lingual groove. In the U, or H, or two-cusp type, the general outline is a more rounded one than the Y type, with all line angles being more rounded. The mesial and distal surfaces may converge more toward the lingual, making the lingual portion narrower than the buccal. The U pattern is formed by the central groove and portions of the two buccal triangular grooves, creating a crescent shape. The only two pits, the mesial and distal pits, are the point of union for the same primary grooves described in the Y type. The H pattern is formed by the central groove and a portion of the four triangular grooves. The central groove runs roughly in a straight line between the two pits, in contrast to the crescent shape of the U type.